Dr. Cory Glenn, and I wanted to do something a little bit different today. So I'm a big fan of podcasts. I listen to them all the time. I find them entertaining, teaches me a lot about different subjects, and so I thought I would actually start my own podcast, primarily geared towards patients and potential patients. So we're going to have some fun with this. As you can see, it's going to be highly produced. It'll probably be me driving around in the car, talking at the camera, because that's when I've got the time to do this. But we're going to have some fun with it. I'm going to have different specialists on. We'll talk about all different types of topics in dentistry, and probably some that aren't in dentistry. We'll get patients on that have had certain procedures and discuss those, see how they've gone, what to expect from those. And just any questions that you've got, feel free to email those to me, and we'll try to see if we can answer those, potentially do an episode on them. And of course, our phone number is 931-967-1933. We're happy to answer any questions that you've got as far as that goes. So I thought the first episode that we should do is just about who I am. Obviously, if you're considering coming to our office for the dentist, then you probably are interested in knowing who would be treating you. So as I said, my name's Cory Glenn. I'm 33 years old, and I am the senior dentist and owner at Glenn Dental. And so I have been in this practice for about 8 years now. We came in 2008, and a little background on me: I actually am from Jonesboro, Arkansas, so I am a transplant to Middle Tennessee. Went to Arkansas State University, which was in my hometown there, and got a BS in biology and a minor in chemistry. And then following that, well, actually during that time, I actually started working for an oral surgeon, so Dr. Steve Modeleski in Jonesboro, Arkansas, and I just absolutely fell in love with dentistry, with surgery, a lot of the things that I saw him doing day in and day out. And so it was fairly certain I wanted to go to dental school, so that's why I ended up applying. I got into UT Memphis, so that was about an hour away from home for me, so lived in Memphis for 4 years, did dental school. Really like dental school. It's one of those things that if you had to go through it again, you'd never do it again, but so glad that I did it, because I absolutely love dentistry, and made some great friends while we were there. Ended up doing a 1-year additional residency called an Advanced Education in General Dentistry. So I stayed in Memphis for that year as well, and that was a great opportunity because I got to do a lot of more advanced cases that you typically don't get exposed to during dental school. So full mouth rehabilitations, that's where I got my start placing dental implants. My residency director, Dr. Steve Floyd, was one of the leaders in implantology at that time, and so he was a huge help in getting me trained on placing dental implants. So really beneficial year. I actually got to go attend the Pankey Institute, which is one of the leading educational programs for dentists. And so just a huge benefit to me, and really gave me a lot of confidence as I started out on my own in practice. So I married a Tennessee girl. My beautiful wife Amanda is from Jasper, Tennessee, which, if you're living in the Winchester area, you know, as you go to Chattanooga and cross over the lake about 40 minutes away, that's where she's from. So we were really looking at practices anywhere between Arkansas and Tennessee, and just happened upon the practice in Winchester. And for those of you that don't know the background, that office has been a continuous dental office for, I think, well over 50 years. There was Dr. Templeton, who was, kind of a legendary dentist, did all of his own gold castings, really a sharp guy from what I'm told. And then that was followed by Dr. Mike Stewart, again, a really sharp dentist, a Pankey-trained dentist. He was also in the Air Force Reserves, and had a great practice. That's actually who I bought the practice from. And unfortunately, when I finally met Mike, he was actually fairly far along in his battle with cancer against a glioblastoma, which is a brain tumor. And unfortunately, that cancer did end up taking his life. But by then we had met, we actually transitioned the practice, and I ended up purchasing it, and I've never looked back. This has been just a wonderful, wonderful place to live. And we are just thankful every day that we ended up in Middle Tennessee, and in Winchester particularly. So that's kind of how I ended up here. A little bit about our practice. When we started out, I figured out fairly quickly that I wanted to do a lot of more advanced work. That was what I was trained in my residency, and so wanted to do a lot of that advanced work, a lot of the implant type stuff. And one of the challenges I quickly ran into is that Middle Tennessee is a lower income area. Most of our patients are good blue collar working folks, but they don't have the money to spend $50,000 on a full mouth rehab, or $80,000 for a mouthful of implants and bridges and all this kind of stuff. So one of the things I had to figure out fairly quickly was if I wanted to do a lot of this higher end dentistry, I was going to have to figure out ways to do it within patients' budgets. And so within the dental world, that's kind of one of the things I'm known for, is teaching other people how to stage treatment, how to be able to pull off comprehensive, larger cases, staged out over time so that patients can actually afford it. Most of us, if we're buying a house or a very expensive car, don't just go pay cash for it. And really, I don't expect that most patients are going to be able to do that either for doing really big case dentistry. And so that's one of the things I'm kind of known for. I actually do a lot of lecturing on that topic and another, which I'll talk about in a minute. So in practice, we started doing a lot of unique cases and figuring out different approaches to be able to do those things that I mentioned. I also found out I really love technology, and so during the time that I've been there, we've actually renovated the whole practice, all new equipment. That didn't happen overnight. That's been done in a staged process. But we've had digital impressioning systems, in-house milling where we can mill our own crowns. We use lasers. I do use a microscope. I use loops and magnification for every single procedure, no matter what it is. I really think that vision is key in doing dentistry. We're working in a small, dark hole, and if you can't see, you can't do high-quality work. And so that's why I use loops or the microscope for every single procedure that I do. I also do a lot of photography. And so if you're one of my patients, you've probably seen me, taking a bunch of pictures during the procedure. We always ask, obviously, and we never put your face up on Facebook or anything like that. But again, because I do lecture, I document extensively. And it's also a benefit to our patients because when we have patients come in that are interested in a particular procedure, generally I can show them pictures of entire cases that we've already done that's very similar to what they're considering having done. And so we can actually show the results that we can achieve for them. And so I do take a lot of pictures and document, as I said. We have some other technology. We use what's called cone beam CT imaging. And so this has been probably the biggest game changer in my practice and probably in dentistry to this point. But if you've ever had the panoramic x-ray, which goes around your head and it gives the big picture view, that's still a two-dimensional picture, just like our bite wing x-rays or a periapical x-ray. We're looking at a two-dimensional image of three-dimensional structures. Your body is obviously three-dimensional. And so the cone beam CT imaging, what that allows us to do is in an 8-second scan, very similar to what we did in the panoramic image, we can actually get a three-dimensional image of your teeth and jaws. And this is hugely beneficial because now, let's say we're going to do an implant on a person. Now we can do the scan first, and then we can actually look at this and rotate through the patient's jaws. We can slice through them in every different dimension. We can see how much bone there is, where all the vital structures are, nerves, arteries, sinuses. We can know exactly how much room we've got to work with before we ever do the procedure. And then if we decide to actually go through with the implant procedure, we can actually use that to generate a 3D guide. And so this is one of the other things that I'm somewhat known for in the dental world is that we do every single case fully guided, meaning that we do plan them out in 3D. And then once we've planned them out, we generate a three-dimensional guide and 3D print that in office. We've got a couple of different 3D printers, which is some of the technology that we also use. But that guide gets printed so that when we go into surgery, it's merely a matter of popping the guide on. It guides our drills. It's usually a one drill approach. We go to length, we're out, we put the implant in. Really quick, really easy. I would say an average single tooth implant takes us between 5 and 15 minutes. So most people hear dental implants and think, oh, I've got to go to the oral surgeon, I've got to go to sleep. It's going to be just weeks and weeks of pain. That couldn't be further from the truth. Dental implants in general are much less traumatic to place than getting the tooth out in the first place. So don't let the fear of dental implants stop you from ever pursuing them. They really are a great treatment modality, and they're not as bad as what you probably have in your mind that they would be. So we do use the cone beam imaging technology, and all of that process is something that I probably lecture on most extensively. In fact, as I'm doing this right now, I'm on my way to Cookeville to speak at the 4th District meeting this morning on the topic of digital implant dentistry. And next week I'll be going to Los Angeles to do another course, a 2-day hands-on course, actually teaching doctors and attendees how to carry this process out, how to do the planning, all of the stuff that goes into guided surgery. So really, really love that. And I love the lecturing part of the practice. The documenting and the teaching other dentists is just so much fun to me. I really enjoy it. So that's something that I do quite a bit of. So what else can I tell you about our practice? As far as our staff, so we have Becky and Mary are our 2 assistants. Becky has been there since the dawn of time, and she will tell you that she got out of diapers and started assisting chairside. So Becky's been there forever. Mary's been there almost as long as I have. Both of them phenomenal assistants. They do an excellent job. They always do a great job of putting patients' mind at ease, at explaining procedures. Oftentimes, by the time I finally come in and talk to you, they've already explained the procedure, what needs to be done, what your options are. So both are phenomenal assistants. At our front desk, we have Sylvia and Jill. And so Jill primarily does our insurance and billing, and Sylvia is primarily our scheduler and receptionist. So she's who greets you when you walk in most times. Again, both ladies are phenomenal at their job. Sylvia is excellent at handling our patients on the phone and trying to get you in, get your needs served. Jill is always going above and beyond to try and make sure that your insurance estimations are as accurate as they can be, that we're trying to bill everything fairly and properly. And so again, both ladies are extremely good at their jobs. And then finally, at the dental hygienist positions, we have Deborah and Courtney. And Courtney's been with us since probably about 5 years ago. And Deborah has actually been in the practice all the way through Dr. Stewart's time in the practice and a little bit of time with Dr. Templeton. And so she's been there for years and years and years. And an amazing thing about Deborah, in all that time, and I hopefully she won't kill me for saying this, I think it's nearly 40 years that Deborah's been working as a hygienist in that particular practice. I think she's only missed 1 day of work. Just unbelievable commitment to her job, to her patients. So both of those ladies are phenomenal. Deborah's got a loyal following of patients who have been with her forever. Courtney does too. She also does most of our new patient exams and generally our deep cleanings that need anesthesia, things like that. Courtney is who handles those. And so again, both are phenomenal at their job. There's obviously me. My wife, Amanda, also helps out. Amanda is a hygienist. And she also, through college, actually ran the front desk for a dental office, actually an orthodontic office. And so Amanda is such a valuable person to have because anyone who's sick, she can pretty much fill in anywhere that she needs to, with the exception of assistants. So I'll tell a quick little story. Early on in the practice, we were broke, obviously, and my dad needed a dental implant. And so I thought I would be cheap and not have to pay staff, and so we got Dad up there on a Saturday, and I said, Amanda, you obviously deal in the mouth, you need to come and help me. And so Amanda comes in, and we're about to do the procedure, and we just get the instruments out and start to do just a small incision, nothing major at all, just a very small incision, and Amanda starts to lose it, nearly passes out. And so I think that's just a little different when it's someone that you know. I ended up having to do a dental implant on my dad by myself, trying to suction and place the implant and all that kind of thing. We got it done, but not something that I want to repeat. So I always give Amanda a hard time about that. But we do have one of the best staffs that we could ever have. I couldn't be more proud of all of those ladies. And currently we actually have Dr. Reid Hill working with us. So I'll talk a little bit more about how that came about here in a moment. But Reid is a graduate of UT as well, so I know his dental background. He got a great education at UT. He also went on to do a GPR residency in Augusta, and so Reid actually got to place a lot of implants during his residency. He got to do third molar surgery, IV sedation, a lot of really advanced things. And so Reid has been a tremendous benefit to our practice here recently as well. He's been with us now about 8 months. So we've got a great staff to take care of you. You know, we're doing a lot of different procedures. Pretty much anything that doesn't require sedation or isn't just extremely advanced, we're able to do in-house. Obviously, there's always root canals or certain surgical procedures that benefit from a specialist's help. Orthodontics, a lot of times we refer out. So we use our specialist, and we have some of the finest specialists in the country right in this area as well. But a lot of things we're able to actually do in-house. So that's a little bit about the practice. A little bit about me personally. So again, I was born in Arkansas. I married my beautiful wife Amanda, and we actually have 3 little girls. And so I am outnumbered every single place that I go. When I'm at work, it's 7 to 1, and when I'm at home, it's 4 against 1. I've got Allie, Audrey, and Leah. So Allie is 7 years old, Audrey is 5 years old, and Leah is 3 years old. And they are all just hilarious. They are the joy of my life. I love spending time with them. And again, being outnumbered at home, we've even got Lulu, who is our little dog, who's a female, and Lucy, our cat. Lucy actually had a twin brother, and so both cats were given to us, and Charlie was the male cat. And so Charlie was my lone male companion. And it took Charlie living there about a month or 2, and Charlie moved down the street to my neighbor Jake's house and hasn't been back since. And so Charlie just couldn't take all the estrogen at the house. So I've just succumbed to it and realized that God in his wisdom has just decided that I need to have a lot of women in my life, and I guess I'll be well taken care of for many years. So wonderful family. Let's see, what else can I tell you about myself? As far as hobbies, I love the outdoors. I love to hunt, to fish, to do photography, to be out on the lake. We spend a lot of time on the lake, skiing, just swimming, doing different things. I do some woodworking. I don't get to do as much of it as I would like anymore, but one of the things I like to actually make is longbows. So, like the longbows that you would go hunting with. And so I actually make those and really enjoy doing that. I play guitar. I actually play guitar and bass, and so we're members at First Baptist Church in Winchester, and I actually play in the praise band there. So if you've ever been to church there, you'll see me up on the stage playing. And actually during college, I did a lot of playing gigs and things like that. Figured out pretty quick that dentistry was going to be a safer career path for me than music was, but I do love playing music. I do the photography again, and a lot of that professional as well, doing the photography of the work that we do, so that I can use that for sharing with other dentists. So those are kind of what I like to do, and to be honest with you, dentistry is as much a hobby for me as anything else that I do. I just love it. I'd almost do it if no one paid me. Now don't take that literally, because Jill's going to call you to get you to pay, but I just really enjoy it. And so phenomenal career path for me, and I couldn't be happier about that. As far as recently, I've had a pretty interesting year. So in 2015, we had kind of a record year. My lecturing stuff was taking off. I was traveling 1 to 2 weekends a month all over the country, just having a blast doing that. The practice was going great. I was totally covered up with work to do. I really couldn't handle any more than we were doing. Record new patients, income, all that kind of stuff that you would, I guess, were the measurements of success in the field of dentistry. And by the end of the year, I was just feeling really run down and just worn out. And so didn't think too much of it, thought I was just kind of overdoing it, which I was. And those symptoms kind of progressed. So by December, I was just having just a terrible time. My back was just killing me every single day. I was having odd bruises. I was exhausted, and what finally made me go to the doctor one day is I was doing an extraction, and my hand just cramped up around the forceps. I couldn't hardly get it open, and so it's hard to do dentistry when your hands don't cooperate. So I finally broke down and went to the doctor, And again, we didn't think too much about it, expected everything was okay, going to do blood work, I need to focus on my health, I'd let my diet slide, exercise, all that kind of stuff. And so got the blood work back, and I got a call from my physician that it didn't look good. And I had pancytopenia, which means that all of my blood cells were just extremely low, dangerously low. I had almost no platelets, no white blood cells, no immune system, any of that stuff. And so he told me that I actually needed to go get a bone marrow biopsy at Tennessee Oncology. So right after I heard the word oncology, I knew something wasn't good. And so I ended up getting the bone marrow biopsy. Those are not much fun, in case you're ever wondering. And got the call a day after Christmas that, in fact, I did have AML leukemia. And so that rocked my world. I did a quick Google search. I don't recommend that. Dr. Google is not the best place to go for your medical information, but I give into it sometimes as well. And a quick Google search told me that I had about a 30% chance of living through this at 5-year mark at my age. And so really, really rocked my world. Had a literal and figurative come to Jesus moments with that. Very concerned that I wasn't going to be there for my family, very concerned with, how I'd spent my time in my life to that point and how I was going to spend what time I had left. And so was told that we needed to report immediately to the hospital and begin chemotherapy. And so we went to Centennial Hospital and actually spent the whole month of January in isolation. I couldn't leave my hospital floor because of the immunosuppression. And so I did chemo for that whole month in the hospital. And man, you talk about just wanting to go stir crazy, not having the freedom to actually go out of a single floor of the hospital, not being able to breathe fresh air. Gosh, I just about lost it, being an outdoors lover like I am. But made it through that. One of the things I didn't mention was that when we finally met the doctors and specialists who would be treating me, I got the great news that I actually had a rare subtype of AML leukemia called APL, acute promyelocytic leukemia. And the good news on that was that I was low risk, that the cure rates on that cancer are one of the highest of any cancer that's out there. And so I had a huge turnaround there, and we just had to go through the chemo process. And if I made it through the early part of taking the chemo drugs, generally they expect a full recovery. And so it was a long road. I was 8 months in chemo. So from December 26th until just about 3 weeks ago, every day after I got out of the hospital, I was having to drive to Nashville, 2 hours there, 3 hours of chemo treatment where they infused me with arsenic, and then 2 hours home. And so, it kind of ate up my life. So if you've not seen me in the practice recently, that's why. I was kind of making sure I didn't die on you. But we did get the all clear report about 3 weeks ago that there's no trace of the cancer in my body. And from here, I'm released to get back to work. And so definitely don't have my energy back yet, and still having some minor back issues, but I am working now and starting to ramp back up. And so I'm looking forward to getting back to what I love, which is doing dentistry, taking care of our patients. But there's a lot of really good things that actually came out of me having cancer. I often tell people that cancer is like one of the best things that ever happened to me because, as I mentioned, with all the stuff that I had going on, the practice, the lecturing, a lot of that kind of thing, I had let a lot of things slide that I shouldn't have. My health, obviously I was not eating right, not exercising at all, had packed on a lot of extra weight. My family, I really think I should have been placing more of an emphasis on spending quality time with them, not just being so worn out by the time that I got home that I just had to hit the couch and just watch life go on with them. Time with my wife, obviously, making my faith a priority. Those are all things that had just kind of fallen to the wayside during that time. And so having this cancer gave me a huge wake-up call and gave me a shot at what I call Life 2.0, where I got to really reorient my life and focus on what's important, and make sure that I'm putting those priorities first, and then the dentistry and the career and the lecturing and all that other stuff can be filled in around that, and still have plenty of time for those. But I'm really making an effort now to keep the first things first. And so, it's hard if you're in the grind every day to have that perspective. But man, when you think you're going to die, it reorients things pretty quickly for you. So I was actually really thankful to have gotten cancer, more thankful that I was able to live, but it was one of the best things that could have ever happened to me. So that's me in a nutshell. So if you've got future questions, again, if you want to hear different topics discussed, we'll be happy to do that. And if you need to contact us, then the office number is 931-967-1933. And I look forward to future episodes, but thank you for joining us for episode 1 of the Glenn Dental Podcast. We'll see you soon. Thanks.